rotating blades in the breeze. This idea represents the experience with vertigo, where one feels stable while the world spins around. And the fact that this windmill is seated in the periphery of the scene should remind you that this part of the image will be dedicated to the peripheral causes of vertigo. Now, looking closely at this intermittent spinning motion effect, we can tell there were multiple sudden, intense gusts of wind that caused the blades to spin that way. This should remind you that peripheral vertigo presents suddenly with intense, intermittent symptoms. Unfortunately, this revolving windmill seems to have fanned the flames of a fire in an outdoor maze or labyrinth. Now, this flame will symbolize inflammation, and the fact that it's affecting the labyrinth should remind you of labyrinthitis, an inflammation of the inner ear. It can be caused by a viral infection or rarely a bacterial infection. Now, labyrinthitis presents with vertigo and is associated with nausea, vomiting, and ipsilateral hearing loss. And treatment involves intravenous antibiotics or tympanostomy tube. Windmills are traditional to this area. And here we see a model of a new windmill about to be built just a few yards in front of the labyrinth. And while setting up the model, this worker slipped and lost his balance. To stop himself from falling back, he clutches the blades of the windmill model, causing them to rotate. You can say the change in position is what caused the windmill blades to move. This idea should make you think of benign paroxysmal positional vertigo, or BPPV for short, which is another cause of peripheral vertigo. Normally, there's a collection of calcium crystals found in the inner ear labyrinth known as otolith, and that can help perceive linear acceleration, both in the horizontal and vertical direction. In patients with benign paroxysmal positional vertigo, the otolith will discharge from their normal position within the utricle and migrate to the semicircular canals over time. And that condition will present with a sudden spinning sensation, and it's triggered by sudden head movements, and it usually lasts less than a minute. And the diagnosis is clinical, with symptoms that you can reproduce in the clinic. You can do that with the Dix-Hallpike maneuver. Now, performing a series of motions for your patient in a maneuver called the Epley maneuver can actually help dislodge those stones from these semicircular canals. Behind our unbalanced worker, we see a man dressed in work overalls and carrying a pickaxe. He must be a miner who works in one of the nearby caves. Well, this miner is here to remind you of Meniere's disease, another peripheral cause of vertigo and lightheadedness. Now, as the disease progresses over time, these symptoms may actually last longer and longer and eventually become permanent. Now, the cause of Meniere's disease is unknown, but the presenting symptoms are due to endolymphatic buildup. Now, endolymph is a fluid that normally circulates through and it's reabsorbed by the inner ear. In Meniere's disease, the inner ear has difficulty with reabsorption, causing this characteristic feeling of fullness in the ear, and patients can even have tinnitus and hearing loss. And diagnosis is clinical, and the treatment is focused on really just treating the symptoms. So now let's turn our attention to what is lurking behind the hill. It is yet another windmill. That large windmill in the center of our scene, half hidden behind the hill, appears to be spinning much more slowly than its counterparts. This will be our symbol for central causes of vertigo, which, like this windmill, are more insidious and produce symptoms that are milder and more constant than peripheral causes of vertigo. In front of this large windmill is another miner wearing a brain-shaped drinking hat. Now, mining is hard work, and he's doing his best to stay well hydrated with this innovative addition to his hard hat. And if we look closely at the drinking straw coming out of the hat, we can see that it is visibly clogged, obstructing the flow of liquid from the brain to the mouth. This clogged straw in a brain-shaped drinking hat is our recurring symbol for ischemic stroke, which can be a cause of central vertigo. Now, impaired blood flow to the brain can present with lightheadedness, as well as nausea, vomiting, altered consciousness, and weakness. And treatment involves restoring blood flow to the affected areas of the brain as soon as possible, and also preventing future strokes by treating the patient's risk factors. Now, this miner is so frustrated at not being able to extract any water from his hat that he's thrown his axe straight at the head of one of his coworkers. Thankfully, this coworker is also wearing a brain-shaped hard hat. Now the pierced open hard hat is leaking red cola all over his head and face. That should remind you of an intracranial hemorrhage, which can be another cause of central vertigo. Now, compression of brain tissue caused by intracranial hemorrhage can additionally present with headaches and focal neurologic deficits. Now, hemorrhagic stroke is diagnosed with a non-contrast CT scan of the head and is treated with rapid blood pressure control. Now let's look at these palm trees that have been planted recently in front of the mine's entrance. This is a mining country, and the palm trees are not native to this area. The owner of the company must have imported these plants and planted them here to spruce things up. Now, some of the trees are so new that they still have their protective wrapping on, but those trees without protective wrapping are slowly wilting away and dying. Again, they're not native to this area, and can't necessarily handle those harsh conditions without that wrapping. Now, the shape of the wrapping around the palm trees is here to remind you of the myelin sheath covering the axon of a neuron, while the unwrapped palm trees are here to represent degenerated myelin sheath as seen in multiple sclerosis, which is an immune-mediated inflammatory demyelinating disorder which presents with relapsing and remitting symptoms, which is another cause of central vertigo. Diagnosis can be made with a brain MRI showing periventricular plaques or a lumbar puncture that shows oligoclonal bands and myelin basic protein. And multiple sclerosis is treated with a combination of steroids and immunosuppressants. Let's turn our attention to the cliff where we see a tree branch peeking out of the top. If we look closely, there's a snail with a bright red shell slowly creeping, not noticing that huge patch of moss that's stuck to its antenna, which is further slowing down its progress. Note that the shell of the snail and the snail's antennas are shaped very similar to the anatomy of the inner ear, whereas the moss sticking to the snail represents the vestibulocochlear nerve, or the 8th cranial nerve. And the fact that the moss is forming a mass should remind you of a mass in the vestibulocochlear nerve, also known as an acoustic neuroma, a benign tumor originating from the 8th cranial nerve that can cause central vertigo. Like snails, acoustic neuromas are slow-growing and are not life-threatening, and usually present with hearing loss on the side of the tumor. Now, if tumors are present on both sides or bilaterally, then that's strongly suggestive of neurofibromatosis type 2. Now, diagnosis of an acoustic neuroma can be made with an MRI to visualize the mass, and then treatment depends on the size of the mass and how it's affecting nearby structures. It looks as though there's a shortage of water supply at this facility. Aside from the employees wearing drinking hats to work, one miner has even resorted to tearing apart this watering hose supplying a brain-shaped tree just to access some water. Well, the hose is red to remind you of an artery, and the fact that it's getting dissected should remind you of an arterial dissection, particularly carotid artery dissection, where an incomplete tear in the layers of the carotid artery causes decreased blood flow to the brain. The resulting cerebral hypoperfusion can cause vertigo, making carotid dissection another one of our differential diagnoses. A carotid dissection can be visualized with a CT or MR angiography, and it can be treated with medication to prevent the formation of clots that could end up leading to a stroke. In severe cases, it may actually require surgery. Now that we've discussed the central and peripheral causes of vertigo, let's move on to discuss lightheadedness. To make sure the causes of lightheadedness are distinct from those of vertigo, we've given the characters a different color of overall. So let's start with this character here, who's having a dizzy spell. You can tell it's a bad one because he's seeing stars. He's stumbling around, trying to regain his balance, and he doesn't realize that he's heading towards the edge of a large cliff. Some causes of lightheadedness can have serious consequences, and this unfortunate miner will be our symbol for those serious causes of lightheadedness. And let's keep our fingers crossed so that he doesn't take any wrong steps as we discuss the differential diagnoses of serious lightheadedness, which will take place around this dangerous cliff. Now, it seems like the shortage of water was a plumbing issue, but we've got a maintenance guy on the premises, finally. He's trying to fix this heart-shaped drinking fountain so that the miners can finally quench their thirst. He uses some sort of electrical device to check the drinking fountain automated settings. And things don't look promising, however. The electrical impulses from the device seem to be irregular, causing the drinking valve controller device to explode. As a result, the fountain valve gets destroyed, making water spray everywhere, further worsening the situation. Let these irregular electrical impulses and the broken valve of the heart fountain remind you that lightheadedness can be caused by cardiac issues, like arrhythmia and valvular issues, and those are serious causes of lightheadedness. Right in front of the tree branch, we see some red balloons falling downward. These balloons were flying just fine until some balloons became deflated, causing this drop. The deflated balloons don't look like they have much oxygen inside, and we can say the oxygen carrying capacity is lower in those deflated balloons. Now, red deflated balloons are our recurring symbol for anemia, another differential diagnosis of lightheadedness. Along with lightheadedness, anemia can present with symptoms like fatigue, weakness, and pallor. Now let's take a look at another distressed mine worker at the edge of the cliff. Take a closer look at the skin of this poor guy. It's very gray and discolored, with a dark green hue around his eyes and nose. Well, this gaunt, sickly man, with his odd skin, looks almost zombie-like. Well, zombies are a recurring symbol for infection, one of our serious causes of lightheadedness. Now, serious infections can lead to sepsis, which can cause systemic vasodilation, ultimately leading to severe hemodynamic instability, resulting in cerebral hypoperfusion. Management involves immediate resuscitation with IV fluids or vasopressors and empiric infection control with broad-spectrum antibiotics. It looks as though this miner has been here longer than his fellows and hasn't had anything to eat or drink for days. He's vigorously drinking the last drops of the syrup from a near-empty bottle he found in one of the mines, hoping it will give him some energy. Well, the syrup bottle is our symbol for glucose, and the fact that the bottle is empty should make you think of hypoglycemia, which is another differential diagnosis of lightheadedness. Hypoglycemia presents with sweating, tremor, agitation, altered mental status, and can even lead to coma or death. And management of acute hypoglycemia can include immediate oral glucose, intravenous dextrose, or intramuscular glucagon. Next to the entrance of the mine, we see a worker who's having a serious time due to the shortage of water. He's swaying on his feet, sweating profusely, with his eyes rolling into the back of his head as he falls to the ground. This man will be our symbol for vasovagal syncope, a cause of lightheadedness triggered by an overactive parasympathetic response, or an underactive sympathetic response. The specific triggers for vasovagal syncope are dependent on the person, but usually involve emotional stressors, seeing pain or blood, or simply standing for a prolonged amount of time. A vasovagal attack causes bradycardia, vasodilation, and reduced blood pressure, ultimately leading to cerebral hypoperfusion. And treatment can include avoidance of triggers, lifestyle changes, medications, or simply remembering to unlock one's legs, especially when you're standing for a long time. Now, the question marks on this miner's overalls are here to remind you that vasovagal syncope is an example of a non-specific cause of lightheadedness. Next to this guy, we see his girlfriend who's sobbing dejectedly for what he's experiencing. As a drama queen, she cries excessively, and she's falling backward as a reaction to what she's watching. Now, crying excessively, beside the shortage of water, caused her to have volume depletion, leading to hypotension that made her fall. Now, volume depletion can cause orthostatic hypotension, which is another on the differential diagnosis for lightheadedness. Orthostatic hypotension can be diagnosed by measuring a drop in systolic blood pressure of 20 millimeters of mercury or a drop in diastolic pressure of 10 millimeters of mercury within 5 minutes of sitting or standing from a supine position. So in other words, getting hypotensive when standing up. Now, volume repletion and adequate intake of sodium are actually the mainstays of treatment. And with that, we've learned all about the differential diagnoses of central vertigo, peripheral vertigo, and lightheadedness.